get started now. For roll call, we'll start with Cindy, Maria Thompson,
Here.
Valerie, Hutchinson or Nancy? Valerie Nancy, Keith Blocker, Naya Hubbard,
Here.
Sylvia Hubbard, Leroy Jackson, Shane Bailey, Amber, I'm here, Deborah, Joseph, Bernadette, Keith Boyd, Lisa, Kevin, yeah, I'm sorry, Jadon Wright, Paris,
Here.
John Curry, John Acevedo,
Here.
Eric Miller, Sandra White,
Here.
Evelyn Eula,
Here.
Juliet,
Here.
Joshua, Felicia, Charles W. Martin, Valenthea, Yule, Derek
Here.
Laverne, Dina, Eric Martinez, Cynthia,
Here.
Ken Barger,
Present.
yeah, Nathaniel, Daniel Merkin,
Here.
Marlinda, Philip. Good, we have a quorum. So if we could have the new members, we'll start this direction, introduce themselves and tell us where you're from, like what city it is, and why you're so happy to be here, kind of thing.
Even if you have to make it up.
Good morning, everyone. My name is Lisa Cohen, and I'm the HMBA's program coordinator from Area 5, which is now Tampa County. And I'm here, back actually at the table. I was here many years ago, and I'm excited to represent Area 5, 6, and 14 as the representative for the Department of Hospital.
What's next?
Oh. I'm not even over
Thanks, Juliet. The one, we need to make sure that you're speaking into the mic for two reasons. One is the sound's not hearing very well, but also, and I'm talking to everyone, this is recorded. So if you're not speaking into the mic, it doesn't pick up on the tape recorder as well. No, we heard you. This mic right here is really kind of sensitive, so that's good. I didn't hear your name, and I'm sorry.
Oh, me?
Yes.
Oh, okay. Good morning, everyone. My name is Naya Hubbard. I'm with MACA Inc. It's in Leon County, and I'm the prevention representative for Area 2B that covers Leon, Gaston, Jefferson, Wakulla, Taylor, and Jefferson County.
Liberty and Madison.
Yeah, Liberty and Madison.
Thank you.
Good morning, Iris Clemens, rep from Area 7, which is Orange, Osceola, Seminole, and Brevard counties. I am currently the prevention program manager with Hope Health Center of Central Florida. I am happy to be here because this is very interesting. I'm really enjoying being part of this PPG group. I actually left one agency and told them I still wanted to be the rep. Didn't want to give up the position, and then in turn picked up another position in another agency. So that's just how happy I am to be a part of this group. I'm learning a lot. Thank you.
Love that passion. Nathaniel?
Good morning, everybody. I'm Nathaniel Henley from Jacksonville, Florida. And I work for an agency we just called Northeast Florida AIDS Network. I'm the prevention coordinator as well as a medical case manager. I am the new at-large member here. I'm excited about this position. I'm excited about you all and all I can learn from you. I'm just willing and hoping that Kenny teach me the right things.
I hope he teaches you right.
Like, you're not just an at-large, but you're PWMV.
Good morning, my name is Joseph James. I am the rep for Area 4 and newly coming rep for Duval, Clay, Baker, St. John's, and Nassau. I currently work for University of Florida State for HIV/AIDS Research, Education, and Services. I am the medical case manager and the TAI coordinator.
Evelyn.
Good morning. Good morning, everyone. I'm directing the STD HIV program at Broward County Health Department, Area 10. And as Lisa, this is my second time back. I left in about, I think it was 2004, when we had the split position here. And although this is a difficult time for many of us in the movement, there's also opportunity with the National HIV/AIDS strategy, to make some more gains in terms of prevention and to keep focused and let everyone know that prevention is treatment.
On behalf of the chairs, I'd like to welcome all the new members and welcome back those of you who sit around the table. The work that we do here is very important. It's to create a plan. Your voices are very important. You come from different areas, and I know I've said this before, and I'll probably say it again, but remember you're here representing your area. And if you sit here and you're quiet and you don't say anything, then your area loses that voice. And you need to remember that. They sent you here for a reason. So, I mean, it's really important that we work together. We will make compromises.
I'm the Community Mobilization and Media Specialist with the Bureau of HIV/AIDS, and I've been asked to come here today and speak with you a little bit about community mobilization. So what is community mobilization? It's when you're engaging an entire community to build enthusiasm and commitment in an effort to address issues while identifying community priorities, resources, individuals, and needs. And so there are a few questions you should be asking yourself throughout this process. Who are you mobilizing in the community? Who is your target population? What resources does that community have? What's going on in the community right now? Are there other programs or initiatives going on that are similar to what you're trying to do? And what are the pressing needs of the community? And so how does community mobilization work? And so here, if you start at the upper left-hand corner, your first step is going to be identifying your health or community concern. Asking those who, what, when, and why questions. And so in our case, our health concern is going to be preventing the spread of HIV/AIDS. And so your next step is going to be organizing the community for action. Really building that trust, credibility within your community and having that ownership within the community. And so your next step is going to be exploring and setting your priorities. Understanding the health issues of your community are going to help you know where you need to place your efforts. And so a good way of getting this information is by having key informant interviews, focus groups, reading your mobilization reports, and your comprehensive HIV prevention plan. And so your next step is going to be planning together. Bringing people to the table that are community members, decision makers, leaders, and providers within the community. And it's also very important to include those individuals in the community that are impacted by the health issue and really have them as a part of the planning process. And so your next step is going to be implementing, getting to work, putting your action plan to work. And your next step is evaluating together. How are you doing? Evaluation really helps you determine what changes you need to make throughout the process. And so your final step is going to be sustainability. How do you plan on continuing your activities in the future and keeping your partners engaged? And so what can community mobilization accomplish? It increases community level decision making and ownership of programs. It's a cost-effective way to achieve sustainable results. It brings additional resources to the forefront that you may not have been aware of. And it improves program design, quality, results, and evaluation. And so some current initiatives that are known across the state is Sisters Organizing to Survive, or SOS, Lucis, Man Up, Stop AIDS is Everyone's Business, or BERTA, and the Faith Initiatives. And so the Bureau is really here to assist you. And so in an effort to provide ongoing TA to our partners across the state, we're currently developing our community workstation. And this workstation is really going to be a one-stop shop for you to get all the information you need to know about community mobilization, community planning, emerging issues in HIV, and prevention media, which will be our downloadable files. And so we're also going to be offering some in-depth community mobilization webinars in the future. These are broken down into 16 individual modules that really take you step by step through the entire community mobilization process to really help you get a community mobilization initiative going. And so a couple of the titles of these trainings is going to be creating and maintaining coalitions and partnerships, assessing community needs and resources, and analyzing problems and goals. And so I've placed on the table for you to pass around a copy of our first module, and it has the presentation and the student guide. And so the hopes is that the community workstation and the community mobilization trainings are going to be working hand in hand. So if we have someone in Central Florida or in South Florida that's not able to attend our webinar, they can go to our community workstation and download all of those materials. And so that's just a brief overview of community mobilization. And so here's my contact information. If you ever have any questions about community mobilization, or if you feel like you need some TA or some assistance, you can always call me or email me, and I'll be more than happy to assist you. Are there any questions? Yes.
Where did you say that first module is?
It's going around the
Oh,
table
okay.
right now.
Okay.
Yes.
Tamara, can you talk just a little bit about each of the mobilization activities that the Bureau has? I know there's some new members, even though lots of folks have been in the process for a long time. Maybe just give people the latest on the mobilization activities we're working on.
Sure. And so our SOS initiative is targeted at African American women and really getting them engaged in the process of knowing their status and preventing the infection of HIV/AIDS. And they really want to focus on, your work, where you worship, home, and really just spreading that message. And so Lucis is our Latina initiative, which is Latinas Unidas contra el SIDA. Don't quote my Spanish here, I'm sorry. It's designed to address HIV among Hispanic and Latino women and to encourage Latino women to get tested. And so Man Up is an initiative designed to stimulate and develop the implementation of community action, for our men throughout the state. And so Stop AIDS is Everyone's Business is our BERTA program, where we're really looking at businesses to really get involved in preventing the spread of HIV with posting, posters, brochures, any type of messaging within their business. And then our faith initiatives is not a single faith, but it's an inclusion of all denominations to really get, expand opportunities in our faith organizations to strengthen their capacity to meet HIV needs. And so that's really going on across the state. Any other questions? Yes.
Are these initiatives only in place in certain areas? I know Central Florida, we do have SOS and Man Up, but I have not seen Lucis and Stop the AIDS.
Okay.
In Central Florida at all.
No, they are statewide, and speaking of Lucis, we're looking at expanding that this year to really bring that more statewide. These initiatives are supposed to be statewide. So we're really looking at each of them right now, trying to figure out ways that we can really expand them to actually have them statewide. So if you have any suggestions, or like you said, if you feel that it's not in your area, please by all means contact me and I'll definitely take those suggestions. There's a question back here? Yeah, please.
Crystal Payne, Area 9. My question was regarding the youth. Do you have any initiatives, future initiatives geared towards the youth, specifically the Black MSM or any Hispanic MSM youth? Which I know Get Yourself Tested is a pretty big initiative, and I think that's more geared towards the youth, but I just wanted to know what you're working on as far as community mobilization in that area.
Okay, I don't have any areas identified right now with youth. Marlene, did you want to comment any on that? We don't really, at this point, have any initiatives in the work from the state level for targeting youth.
Yeah, what we do, it's not so much mobilization, and I know that's an area that really April and her team need to focus a little more on, but we do things like bloodlines, for example. We do work with schools, we work with DJJ facilities. You know, there's a number of sort of little things, and a lot of that is kind of driven by the area themselves. You know, if there's a initiative or a project or a program that, you know, wants to have, you know, that a local area wants to do, we'll support that. But we don't have anything statewide yet for you. And then another area that you mentioned, Crystal, that we're really weak on is MSM. And I think you can see, you know, from the list up there, that's a glaring omission. You know, what we don't have is a lot of mobilization right now for MSM from out of our office. And so I talked a little bit about that yesterday, but that's something that we need to change, and that's something that we know that we need to work on.
You know, Marlene, I think that you're kind of being a little modest, because I know that Lorenzo does the UGMA,
Yes.
which is coming from you guys, that works with Black gay males around the state. And we just finished Finding Our Voices 2, that's going to come out for, that does encompass young Black gay males.
Yeah. Yeah, and that's a good point, and we talked about that a little bit yesterday. But, you know, it's not that we're not doing anything, it's that, you know, I think that we're not doing enough given their role and, you know, the impact of the epidemic. But thanks, Charles, for those things.
Yes.
This is sort of tied to mobilization because Kenneth Johnson was doing this Facebook kind of arrangement, social marketing issues, and he's gone. Has anybody replaced him with the social marketing stuff?
What do you mean? So because Facebook is social media. Do you
Right.
mean that?
Yeah, that's what I meant. Social media, not social marketing. I'm sorry.
No, not really. That position is vacant still, so that's created a hole there. So yeah, that's something that April and her team are going to have to look at how to get that done.
Thank you.
Yeah, we don't have that.
Any other questions? Thank you.
Thank you, young lady.